Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. My voice is a little squirrely today, getting over a head cold, so I apologize if I sound a little worse than usual. But wanted to stay on task and keep pumping out pharmacology education. So, as always, go check out reallifepharmacology.com. Get your free 31-page PDF on the top 200 drugs there. All right, we are on number 121, and that is Omalizumab. Xolair is the brand name of this medication. As you can typically tell by the ending, if you've got that MAB, M-A-B ending, that is indicative of a monoclonal antibody, which is absolutely true in this case. This medication inhibits binding of IgE to its receptors to prevent IgE-mediated reactions, and this is probably most frequently I see this medication utilized in asthma care, and it is going to be typically given by prescribed by specialty. So pulmonology, for example, immunology, maybe even, with asthma being one of the primary indications. Other indications that you could potentially see it used for, hives, IgE food allergies as well. And just describing that a little bit. So IgE antibodies, these are proteins that are produced by your immune system, and they're intended to help fight bacteria, viruses, anything that's basically foreign. And what's challenging in patients with kind of a hyperreactive immune system, their immune system is attacking things that in most other patients, they typically don't have to worry about reactions to. So patients with severe allergies to, molds, dust, various things like that, and severe reactions to those, what Omalizumab is going to do is help reduce basically that IgE-mediated reaction. And the diagnosis that it's been most proven in is asthma, or where it's initially was indicated for was asthma. Now, when we give this medication, what adverse effects can we expect? Injection site reaction is probably the most common thing you're going to see. Fever, headache, muscle soreness. Think some of the symptoms of maybe an influenza for a short period of time. That can certainly happen. There is a boxed warning on anaphylaxis. So, and due to that risk of anaphylaxis, it's recommended to start this medication within a healthcare setting. Self-administration is possible, but there should be a bunch of things proven that they've, taken the medication before. They know how to do it. There's, they knew what to do in case of an anaphylactic reaction. But again, initiating the drug, first a few doses, I believe, absolutely should be given within a healthcare institution, and then from there a patient assessment can be done of whether it would be appropriate to self-administer this at home for patients. Some other things to think about. We need to observe patients following administration. Again, that's that boxed warning for anaphylaxis. So initially, after the first initial injections, I believe it's 3, we're going to want to observe that patient for at least 2 hours following that injection. Some other considerations with the dosing of this medication, it's typically based on weight and serum IgE. So how high are those IgE levels? In that situation, we're probably going to utilize a higher dose, which kind of makes sense there. Another thing with the dosing, we may have to give patients multiple injections to get the adequate dose if patients are on a moderate to higher dose. So that's another thing that can certainly be a downside. This medication being a biologic type medication, it is going to be more expensive as well. From a drug interaction standpoint, I don't have too many concerns with regards to that. So we'll move on to the next medication here. Number 122 is nitroglycerin. Brand name is Nitrostat. This is classified as a nitrate. It increases cyclic GMP in smooth muscle, which ultimately leads to vasodilation. Indication, angina. That's going to be the most common indication there, obviously, as well as it can be utilized in an MI type situation there as well. Now, recognizing that this medication causes vasodilation, you have to expect that hypotension and dizziness are going to be potential adverse effects, and they certainly are. Headache is also a common complaint with the use of the PRN sublingual nitroglycerin, as well as other nitroglycerin type products. Nitrate tolerance, I did discuss this previously. I believe it was in the isosorbide mononitrate podcast, so go search for that at reallifepharmacology.com, or you can find it on iTunes or whatever platform you're listening as well. So I went into that in pretty good detail, I think, within that isosorbide mononitrate podcast, so I'm not going to go into depth here. Speaking on specifically the sublingual nitroglycerin, which is the most common medication that you're going to see in practice, using it for chest pain, it's dosed 1 tablet, usually that's 0.4 strength, 1 tablet every 5 minutes as needed, and that's for a maximum of 3 tablets. If that pain is not relieved or it's worsening within that 3 to 5 minute time frame, or it's not getting better, it is recommended to seek immediate emergency medical attention. Drug interaction standpoint, it's contraindicated with PDE5 inhibitors. So that's your sildenafil, tadalafil are probably the most common agents there. Those are drugs used for erectile dysfunction, as well as they can be used for pulmonary hypertension too. I created a blog post at meded101.com, so if you search meded101 recommended separation for nitrates and PDE5 inhibitors, that article should come up. And the amount of time for that separation varies anywhere from 12 to 48 hours, and that's dependent upon the PDE5 inhibitor that you're using. So if you want more detail on that, go check out that blog post at meded101.com. And then other drug interactions, obviously, nitro can drop blood pressure. So if we're on other blood pressure medications, obviously it can drop it too far, increase the risk for hypotension. Let's take a quick break from our sponsor, and we'll wrap up with the last 2 medications. If you're in the market for any pharmacist board certification study material, BCPS, ambulatory care, BCMTMS, geriatrics, or the NAPLEX exam, go check out meded101.com/store. We've got a ton of resources there, tons of testimonials, lots of pharmacists, lots of pharmacy students who have passed their board exams using our content that is designed off of each individual content outline. That is really, really important. A lot of other study materials don't necessarily factor in the content outlines for these exams. We do that at meded101, and go check out all those resources at meded101.com/store. Support the sponsor and help keep this podcast free for all to benefit from. Moving on, we've got 123. That is Apixaban. Brand name is Eliquis. This is classified as an anticoagulant, often referred to as being part of the class of DOACs. That's the direct oral anticoagulants. This medication blocks factor 10A in the clotting cascade, which ultimately reduces thrombin production. Indications, atrial fibrillation, DVT, PE, those are the most commonly used indications for this medication. Adverse effects, bleeding. I think that goes without saying. If you're thinning the blood to try to prevent clots, bleeding risk is going to be the potential issue there. Dosing is important. Age, weight, and serum creatinine. If you can remember the numbers 80, 60, 1.5. So age 80 or higher, weight 60 kilograms or less, and serum creatinine 1.5 or above. If they've got 2 or 3 of those, then we're going to reduce the dose by half. So if they're on 5 milligrams twice a day, we'd reduce it to 2.5 twice a day. Drug interaction standpoint. So this medication, Apixaban, is contraindicated with CYP3A4 inducers and P-glycoprotein inducers. Classic examples there, phenytoin, carbamazepine, rifampin, St. John's wort. Those inducers are going to result in reduced Apixaban concentrations and ultimately could lead to treatment failure, which would be potentially pretty catastrophic if we're talking DVT or stroke prevention type indications there. On the flip side, inhibitors can raise concentrations, so particularly strong dual inhibitors of CYP3A4 and P-glycoprotein, such as erythromycin, clarithromycin. The calcium channel blockers, verapamil, diltiazem fall within that category. Amiodarone's got some interaction potential there. So that potential is to raise concentrations and increase the risk of bleeding. All right, next medication is Gabapentin. Brand name is Neurontin. This is classified as an anticonvulsant type drug. Rarely is it ever used for seizure purposes. Occasionally I do see it, but not very often. Also, other classifications, you may hear this medication grouped within gabapentinoid, and that would be grouped with pregabalin, GABA analog, but it doesn't work on GABA receptors, which I'll mention here briefly. And then kind of a general classification, it does have some analgesic or anti-neuropathic pain type properties. So mechanistically, it actually reduces excitation of voltage-gated calcium channels indicated for neuropathy and nerve type pain. That is by far the most common indication that I see this medication used for in clinical practice. So any type of nerve type pain. Other potential indications, restless leg syndrome, have seen it used occasionally for anxiety. Obviously, it being an antiepileptic type medication, it could be used for seizures. Again, not very common there. Menopause vasomotor symptoms, have seen that for try to reduce hot flashes in patients that maybe don't want to take estrogen therapy or can't take estrogen therapy. So lots of kind of wacky, unique indications with gabapentin for sure. Some considerations, alcohol use, not great with gabapentin. Kind of that additive CNF depressant type activity. So generally try to minimize alcohol use if at all possible there. Renal function, this is really, really important. The absorption is important as well. If you Google search gabapentin drug-dependent absorption, MedEd 101, you'll see a nice article written on that. But anyway, higher dosages, you get less absorption with the medication. On the renal side of things, the worse the renal function, the more this drug is going to accumulate. And that's particularly problematic in my geriatric patient population. Maybe a patient's taking 300 or 600 milligrams 3 times a day, for example. Well, that dose might have been fine when they were 62, but now they're 82. Their renal function has declined some, and now that dose may be too high. So something really to pay attention to, particularly in our older patients when it comes to renal function and appropriate dosing of this medication. Drug-drug interactions, the biggest thing that I worry about with this is that additive CNS depressant activity. I talked about it with alcohol a little bit already, but obviously from a medication side of things, we're looking at opioids, benzodiazepines, any type of sleeping medication. These can all have those additive type CNS depressant effects. All right, last medication, 125. We've got Etanercept. Brand name of this medication is Enbrel. This is classified as a DMARD. Etanercept binds to tumor necrosis factor and blocks its interaction with cell surfaces. It's important to remember TNF, or tumor necrosis factor, plays an important role in the inflammatory process. So basically by binding that up, blocking that role within the inflammatory system, we can reduce inflammation. So as you could imagine, Rheumatoid arthritis is a potential indication. Plaque psoriasis is another good example of an indication where we've kind of got this excessive inflammatory type response and processes within those type of disease states, and that's where Etanercept may be helpful in blunting some of those type of effects. Now, there is boxed warnings with Etanercept. It's in relation to infection and malignancy. Obviously, if we kind of reduce or suppress the immune system, infections can happen and cancers can happen. So that's kind of the downside, obviously, the risk versus benefit of appropriately blunting the immune system to help treat their condition, but not blunting it too far that we increase susceptibility to infection and malignancy, for example. So this is a sub-Q injection. Adverse effects, injection site reaction, hypersensitivity reactions have been reported, and a lupus type reaction has been reported too, and then that increased risk for infection and malignancy as well. Wrapping up with drug interactions here, there aren't a tremendous amount of kind of chronic medications, chronic disease medications that interact with Etanercept. Probably one of the biggest things to think about are vaccines. So non-live vaccines, their action can actually be reduced if we're taking Etanercept. So again, in the situation where we have the opportunity to vaccinate a person before we start these medications, that would be great. In the case of live vaccines, it's actually recommended to avoid live vaccines, and that's due to that immunosuppressive nature of the medication there. The only other interactions as far as, kind of chronic long-term medications that I think about are in regards to other agents that can suppress the immune system. So, you have cyclophosphamide, for example, other DMARDs. If we suppress the immune system more and more, corticosteroids, another good example there. If we suppress the immune system more and more with more agents, obviously that can increase that risk for infection as well as malignancy. All right, well, that's going to wrap up the podcast for today. Do me a huge favor. Go to meded101.com/store. Check out products there. Your purchases there go directly to support this podcast. Also, leave a rating review on iTunes wherever you're listening. And share us. Friends, colleagues, classmates, pharmacy students, medical students, nursing students. Help us grow this audience. We greatly appreciate that. If you have any comments or suggestions, feel free to reach out to me at mededucation101@gmail.com, as well as you can connect with me on LinkedIn as well. Eric Christensen, PharmD, BCPS, BCGP. With that, I'm going to sign off for today. Thank you guys so much for listening, and have a great rest of your day.